Okay, hi guys. So we'll just start. I'll give a brief intro. I'm Chetan. I'm part of the team at Boots and Crampons, and today's conversation is different. It's important because if I can put it, high altitude illnesses. It's a bit of a gray area. A lot of us know about it. We have heard of problems and issues, but I don't think so. There's a lot of clarity as far as a lot of these issues go. So I think a lot of people actually going to, even for treks and climbs and everything, they hear of things, the diamox and illnesses and what to look out for. But it's still a bit of a question, and there's a bit of a doubt in their mind. Okay, what to expect, how to prepare, and everything. So we have what who have we have here. We have Dr. Abhijit Adhikari. He's based out of Nepal, and he has extensive experience over the last 5 years dealing with emergency cases. He has been involved in a lot of heli rescues. He see altitude cases and illnesses on a day-to-day basis, if I can put it that simple. And he also says that he holds an unofficial record of the longest patient transfer in the country. So can you share a bit about that? What was that?
Well, that was during the COVID time. We had a COVID patient, and the patient was a doctor himself. He was in the far west region of the country, and we had to go there by helicopter. And the distance was so far that the helicopter had to make two stops to refuel just to get there, and again two stops back to get him to the capital city of Kathmandu. So the whole rescue cumulatively took us over 24 hours to bring him back to our hospital. So that was quite an
Wow,
experience.
yeah, that's a long challenge. So I'm sure you would be having multiple members on the team, sort of taking responsibilities during that sort of duration.
Yeah, usually the issue is with heli transfers is that a helicopter is a very small vehicle. It's basically a small car. So apart from the patient, just two of us and a pilot can fly. So it was me. We had a senior paramedic on board with us, and just the two of us taking care of the patient. And that's what
Wow,
happens in heli rescues.
that's a bit of an endurance challenge also for you guys to
It
be
is. It
aware
is.
and aware on your toes for that sort of a long time.
Yes,
Okay.
it is.
So a lot of these heli rescues and that you have done in the mountains and so many cases you've seen of high altitude illnesses that you've dealt with. How many of these people are actually climbers and trekkers? If you can share in terms of percentage and numbers.
Well, the majority of them are actually climbers and trekkers, and among those, I'd say more than half are experienced climbers who have been to high altitude multiple number of times. And so that's what I want to start with is that if you are even if you are a climber who is experienced, who has been to altitude of multiple number of times, you are still susceptible to high altitude illnesses.
Okay. Yeah, that's one thing that I've heard a lot of people because a lot of people when they sign up for some such activities, let's say endurance-based activities, whether it's a trek, it's a climb or an ultra marathon, a lot of people put their experience from 2 years, 3 years before, and they say, we have done this, we'll be fine. So, but the what I tell them is that the mountains are not keeping a record of how many times you've been to the mountains. So,
Exactly.
you still need to redo the acclimatization process and everything. So this
Absolutely.
is also, I think, one of the. I actually had this question for the later part of the conversation, but I'll start with that actually. That a lot
Mhm.
of people, you see there's some people who are more prone to getting altitude sickness than others.
Yes,
Is there
sir.
a certain type that people should be aware of? Okay, they are in that category.
So the people who are usually more susceptible to getting high altitude illnesses, they are people with some underlying diseases, whether recognized or unrecognized. And the diseases are usually of your pulmonary system, your lungs, your heart, or something related to the circulatory system. Apart from that, there is genetic susceptibility. So you pass your health checkup fine. You are an endurance athlete, and you do very well in low altitude regions with all kind of endurance activities. But still, you get altitude illness when you go into the high altitude areas, and it's difficult to predict. So that's why there is a clear concept for everybody that everybody has to acclimatize and everybody has to follow the protocols so as to avoid getting high altitude illness.
Okay. So these people especially, so when you talk about acclimatization, that is must for everyone. So let's say if there is a 6,000 meter climb, let's say, and they are acclimatizing for a certain number of days, which is like a standard protocol. To these people who are sort of more, susceptible to it, do you sort of recommend any extra steps to take?
So the risk of getting high altitude illness, we usually classify the patients as mild risk, moderate risk, and high risk. So for high risk patients, we try to persuade them not to go to high altitude areas at all. And for mild to moderate risk, again, it depends upon upon multiple factors. And what we do is that we advise them to pre-acclimatize, and that is the first thing we can get into. Is that before you are planning a trip to altitudes of 2,800 meters or above, for a month duration before that, we advise them to get to altitudes of 2,000 to 2,500 meters multiple times and maybe spend a few days in that altitude so that your body is pre-acclimatized and more prepared for acclimatization process itself.
Okay. Okay, so all right, that covers. And any sort of medical preparedness that they need to take, any medications that you advise them
So
that they should.
basically, Diamox is a well-known entity in the climber community, and it is a relatively safe medications. Apart from for those people who have allergy to Diamox, it's a relatively safe medication, and it can be used to optimize the acclimatization process, and it can be even used to treat AMS when we go up. So for people in moderate risk of getting high altitude illness, Diamox is a preferred way of acclimatizing apart from pre-acclimatization through climbs.
Okay, so coming to Dimox, telling people, do you really recommend Dimox to everyone, or do certain kind of people take it? And if someone is allergic, as you said, what kind of allergic reactions are there if you take Dimox? So what to look out for?
So Diamox. So first, I'll get into the allergy part of it. The Diamox can cause actually life-threatening allergies. So the symptoms usually start with skin rashes, and people get short of breath, and they start having laryngeal edema. That is, the airway gets swollen, and the air cannot get through the airway. So that's a very severe kind of reaction which needs immediate management. So one way to avoid it is, what we do for moderate risk patients is if we are advising them Diamox, we usually advise them to take Diamox 2 days prior to going on a climb. So there is a 48-hour duration where the patient is in low altitude, safer area, taking Diamox, and if they develop allergies, they can seek medical help more easily. And so the first part of the question, no, we do not advise Diamox to everyone. So Diamox is for moderate risk patients. So those moderate risk patients would be those who have developed altitude illnesses, high altitude pulmonary edema, or high altitude cerebral edema in their previous encounters with high altitude, and for patients who have other illnesses like pulmonary hypertension. That's a kind of heart lung disease, and for other circulatory illnesses. So for those patients, we use advised Diamox. For everybody else, Diamox remains as a backup, as a treatment rather than a prophylaxis.
Okay. Okay, coming to these issues that you've spoken about, people who have had or do get HAPE, ACE, AMS. Now, I think these three terms are I think the most common sort of illnesses that we have heard of people suffering at high altitude. So can you just briefly explain what these three are and what kind of symptoms do you face for these three?
So AMS or acute mountain sickness is the most common form of sickness people get when they get to higher altitudes. It's even more common than it is reported because the symptoms are so mild that it often goes unreported. So the symptoms usually start with mild headache and maybe nausea in some, but most people identify AMS once they are unable to fall asleep at a higher altitude. So usually the first complaint is, I could not fall asleep last night. I was awake throughout the night. And then the subsequent days, people develop headache, nausea, and the symptoms are usually um, just these three, and the symptoms are easier to control. So for anybody developing AMS, you can either take a painkiller for your headache, you can take something for your nausea, you can rest and not climb to a higher altitude. You can rest at the same altitude for a period of 48 to 72 hours, and the symptoms will subside. Your body will have acclimatized, and then you can carry on with your climb. And high altitude cerebral edema, or HACE, is a more severe part of the spectrum of AMS. So AMS develops into high altitude cerebral edema. What happens in HACE is that the brain starts to get swollen up. There is some edema fluid leakage inside our brain, and it causes all the symptoms of ACE. So people develop varying degrees of symptoms. Some people get drowsy, some people get unconscious. Rarely people have seizures. They will be unable to breathe properly because of the issues in their brain. And so the easiest way to identify when a person has high altitude cerebral edema and has to descend is to ask them to walk in a straight line with their feet in one in front of the other. So if they can do without falling off, so we still have time. But if they can't maintain their balance, that term is called ataxia. And as soon as we recognize that, we have to get the individual down at least 1,000 meter descent to save their lives. Otherwise, usually the time duration, what we say is that once the individual develops these symptoms, it's 24 hours for them to get to a lower altitude. Otherwise, we won't be able to save them. And
Right.
then there is high altitude pulmonary edema. So just like cerebral edema, in pulmonary edema, there is swelling in the lungs. So fluids get accumulated in the lung, and the primary symptoms, the first people develop cough. There might be some blood in the sputum. They'll get short of breath more easily. Initially, there is short of breath during more exertional activities. Then there is short of breath during just simple walking, and at the terminal stage, it's a sort of breath even when they are lying down or sitting around. So that's when, again, that's the more critical part. That's when we need immediate treatment and ideally descent.
Okay. So you said that after, if you have AMS and if you don't pay attention to those symptoms and if you don't, if you ascend quickly or if you don't go back, if you don't take the medications, that generally progresses to haze and HAPE. That's what you're saying.
So
So does
AMS
that,
progresses to haze. Yes, that's it.
okay, so that process with haze. So does that then, is that a general progression of line that after AMS you'll get haze and then HAPE, or it can be other way around also? Because I've seen people also get HAPE before and then haze followed by that.
So AMS progresses to haze, but AMS does not progress to HAPE. However, one single individual can get both haze and HAPE. So
Okay.
it's not mutually exclusive, but AMS progresses to haze. So that's why the milder symptoms of AMS can be easily controlled, and acclimatization in the same area can prevent a life-threatening illness like haze. Uh,
Okay.
but again, haze and HAPE can coexist at the same time in the same individual.
Okay. So as you said that someone is having haze, and if you do that walk test, and if they are not sort of, you don't see them in shape, so you can term that as early stages of haze. So haze
That is
also
actually
has
the
stages.
end stage. That's actually the end stage of this. That's when you have to take
Oh,
the individual down for descent. In early
okay. Okay.
stages, the symptoms might be just confusion, more sleepiness. The individuals get slightly more drowsy. That those are the early symptoms, but the
Early symptoms.
balance test is the end symptom, and we have to take immediate action after that.
Okay. And similarly for HAPE also, I think the initial symptoms are you start to cough or and then you have slight difficulty in breathing, and I think that gets worse and worse. Is that how HAPE progresses?
Exactly. So initially, it just the symptoms are just like a flu. You get some cough, you might have a little bit of breathing difficulty, and then it progresses rapidly into more breathing difficulty.
Okay. So let's say someone is on a mountain, someone is climbing,
Mhm.
because that's the kind of audience who's hearing us out, and they're climbing. It's a whatever altitude peak that is, and you start to get these symptoms.
Mhm.
The first step to deal with that, what would that step be, and what signs to look out for?
So again, so early signs would be for haste, it would be cough and maybe short of breath. You will feel more short of breath than you were before. Now, anyway, when you are doing a lot of exertional activity, you might be getting short of breath. So it might get difficult to distinguish whether it's hip, or you are just out of breath because you are you are climbing up and you are carrying your luggage and so on. But again, it will be slightly worse than what you were having previously, is how we frame it. And so once you see that you have these symptoms, you have to stop and stay at the same level. You can't carry on to climb at a higher altitude. So just stay there, see whether your symptoms are um, relieved on resting or not. So if they are not, you have to go down. There is no other way. You can obviously have temporizing treatment measures like oxygen and gamma bag and so on, which we can talk about later. But again, the ultimate treatment is descent. So you have to go down.
Okay. I saw a question by one of the audience here about dextromethasone. So we've also seen in the movie Everest where one of the actors climbers was at, I think, Camp 4 at Everest, and he was altitude having altitude sickness, and he just took out the injection and took that injection. So what is that? What is that medicine? And do you advise people to just carry that randomly and take it?
So dexamethasone is a very effective medicine for treatment of haze, but it is not actually treatment of haze. It is just a temporizing measure, just like other medications for altitude-related illnesses. So dexamethasone is usually carried as a part of the medical kit by climbers. You know, the thing with dexamethasone is that once you start taking it, again you have to come back down, so you can't carry on further. It's not like you get a sort of dexamethasone and you can carry on with climbing. It does not work that way. But dexamethasone is usually used for haze and even sometimes for AMS as well. So it is effective in saving life, but again, take a sort of dexamethasone until you can go down, and you are not allowed to go to a higher altitude after that.
Okay. And for those people who were, let's say, who were not getting well at that altitude, and then they decided to descend, they came down to the base camp, and they've
Mhm.
gotten a bit better with the symptoms. Uh, what kind of window they have? So let's say they have time, they can settle down, they have enough time to sort their departure and everything, and they have another window. Do you recommend for them to sort of go back again, attempt again? And when should they do that?
So that's where the gray area lies. Usually, if somebody has developed haze or hip, there is high likelihood of them developing the same symptoms again. This, and it might be if they, they resume the climb after a couple of days or even a couple of years. Once they have those, the illness first time, there is always a chance of recurrence. So ideally, it's advised that they do not climb.
Okay.
And so you, especially say, just like the scenario said, you are down to a lower altitude, you have rested for a few days, you want to climb again, that's when you have to stop them. So this is again high risk in a scenario. Maybe there's a small chance that you'll make the climb without any event, but the probability of developing haze or hip again is extremely high, so it's better to avoid climbing again.
Okay. And what is a gamma bag, and what role would a gamma bag play in this sort of a scenario? Either before, during.
So Gamo bag is basically a small bag where you put an individual in, seal them up, and pump in air. What happens exactly in high altitude and with oxygen levels is that the oxygen percentage in air remains constant. As in sea level, like we have about 21% oxygen in the atmospheric air around us, the percentage remains same even in the higher altitude areas. But the overall oxygen pressure, the amount of air itself is low. So that's what is causing the symptoms of high altitude illnesses. What Gamo bag does is that we put the patient inside a bag, which is basically the size of a sleeping bag. We seal them up and we pump in air from outside. So we maintain a pressure of around 100 to 200 millimeter of mercury, and it can be seen through a indicator there. And what that does it creates an effect, immediate effect of descent of about 1000 to 3000 meters. So you put the individual in there, you pump in atmospheric air or oxygen, and the body will react to it as if you have descended. And so again, this can be very useful, very life-saving device when immediate descent is not possible. Say you get trapped in a bad weather condition and there's no way to get the individual down within a day or two. So just put them in a camo bag, and you have to, again, what you have to continuously keep on pumping air in, and
Okay.
it's not a very easy thing to do.
Okay. But this is also sort of a temporary measure. You can only for that particular time save the patient, but then you have to
Absolutely.
eventually go.
So as soon as you take the individual out of the gamma bag, again the body will see that you have immediately
Again,
climbed up 1,000 or 3,000 meters. So no time for acclimatization again. So
yeah.
it's just temporizing measure.
Another thing people commonly see is this sort of symptom of having very dry nose, and then there's a bit of a nosebleed, and there is a bit of a blood that comes out from with a sputum. There's sort of a you cough it out as well. What is that? Is that the initial sort of you just hitting the altitude? That's why it
So,
happens.
so the nosebleed of primary cause of nosebleed in these cases is just dry air. Your nose needs to remain moist for it to function properly. But once it gets dry, the blood vessels inside the nose are very thin and very brittle. So once it's too dry, it breaks off and there is some sort of nosebleed. And it's very easy to manage. You just put some saline drops and it goes away. But what we have to do is that we have to be able to distinguish it from early signs of hip. So you have to make sure that it's not actually you are coughing out blood, it's just a nosebleed. So as far as nosebleed goes, you can just use some saline drops, get control of the nosebleed and carry on.
Okay. These altitude-related symptoms, do you think they're also psychologically induced? Can some people, because of overly being anxious about it or overly worrying about it, can actually get the symptoms?
Yes, they can. There is a significant number of cases that we see is not actual altitude illness, but it's just that people are getting anxious about getting to these extreme conditions. Um, but it's difficult to recognize in high altitude areas because the symptoms are similar. You get sleepless, you might be having a little bit of headache, and you might be feeling sort of breath sometimes. And so it's very difficult to distinguish the symptoms whether it's the individual getting anxious or whether it is altitude related illness. So what we advise is that in that condition, it's always better to take precaution and get the individual down rather than trying to calm them down and taking them to higher altitudes.
Hmm. Okay. Uh, Oxygen, like a lot of people, climbers, their teams and everything, they carry oxygen along with them. Now, there are certain small canisters that they carry because they can't carry heavy loads at the top. Uh, when to take oxygen? At what stage do you think it's I think one should take?
So, if you are actually acclimatizing properly, it's even possible to climb to the peak of Everest without taking oxygen, and people have done that. So, if you are, say, you have a period of a few weeks to few months where you gradually go up and acclimatize, you can actually avoid oxygen. So, oxygen is needed when you are during the process of a climb. You don't have a way to get back. You have to either stay there or go forward, and that's when you need oxygen. Um, but again, once you start taking oxygen, it's always a risky scenario to carry on going forward. So again, the advisable thing would be to spend more time on acclimatization so that you won't need oxygen. And if you do need oxygen, make sure that you have oxygen throughout the climb and throughout the time of descent till you get back to the altitude where you had started taking oxygen.
All right. Another issue that people face at high altitudes is basically, dehydration. They don't, sometimes they're not able to understand how much of water they should take. It can be very cold. Uh, Hi. Hi. So it's generally very cold and people miss taking water, and they then get some sort of dehydration. And then I think one of the symptoms of dehydration is that you do get a headache. Now, can that be mistaken as AMS? And how do you differentiate that this is not AMS, this is dehydration versus the other?
So the thing with dehydration is that dehydration itself can cause AFS in high altitude areas. So proper hydration is necessary, is very important for the body to be able to acclimatize to high altitude regions. So without proper hydration, um, the circulation does not work as effectively as it should have. So even when people get headaches due to dehydration, there might be some component of AMS in it. So hydration is an absolute necessity to avoid AMS as well as to prevent this confusion as well. and that is it's kind of a dual thing. So you have to stay hydrated so that you don't get headache and get confused for AMS, and also you have to get hydrated because you have to avoid AMS.
Okay. Now, when you're up climbing, doing bit of this activity, it's cold and you may be sweating, you may not be sweating. So how do you switch between regular water and something like ORS, or electrolytes? Like how do you understand whether your body is low on the balance electrolyte and you should be taking salts? How often should one take salts?
So when you are climbing, you are doing an endurance activity. It's always preferable to take ORS or Gatorade or salts rather than taking just plain water. So plain water, one thing that plain water does is that it changes the acid base balance of the blood, so that what happens is that the blood might not be able to dissolve as much oxygen as it is possible if you are taking just plain water. So it's always ideal to have a little bit of salt, so ORS, Gatorade, or whatever electrolytes you can get your hands on, rather than taking just water. So it's better to have electrolytes rather than plain water.
Okay. Next question was, one in the audience. Females were having their, cycles when they are going for treks and climbs. A lot of them feel that sort of uncomfortable feeling, and it adds to the sort of a mental stress and some sort of physical stress. So how do you prepare? How do you deal with that?
So the first thing to know is that when they're having periods, or even when they are pregnant, there is no actual medical evidence that it causes any issues when you are climbing. So it's completely safe to go even when you are pregnant or when you are having periods, unless you are having massive bleeding or you are having a complicated pregnancy, you can go up. So as far as the discomfort thing goes, carry some medicines. You might be having pains, you might be having nausea, so just carry some medicines for that. Stay hydrated and you should be fine.
Okay. Before we take some more questions from the audience, another point we had to cover was hypothermia. So hypothermia at high altitudes, what kind of stages we have, and what kind of stage does a frostbite comes? Is that part of hypothermia, or can that happen irrespective of whether you're overall feeling cold or not?
So frostbite and hypothermia are two distinct entities. What happens in hypothermia is that the core temperature goes down. But during frostbite, the core temperature remains constant. It's just the peripheral organs like tip of nose, your ears, your fingers, your toes, they get cold. So they are entirely different entities with entirely different physiology. In hypothermia, when you are in higher altitude, you get hypothermia, especially when you either remove your clothes or your clothes get wet. That's when you develop hypothermia and your core temperature goes down. Um, the treatment for it is gradual rewarming. So gradually rewarm. You remove your wet clothes, you put on warm clothes, and um, you get rewarmed through fluids. In mild to moderate hypothermia, just taking warm fluids, take some tea, warm water, that will help with your rewarming process. So as far as frostbite goes, again, depending upon site of frostbite, you might need immediate medical attention. We see a lot of people who develop frostbite early on during their climb, but say you could get a frostbite on your tip of your finger, but you feel fine. You see that it looks fine. It doesn't look black. It doesn't look blue. So you carry on with the climb, and by the time they come down, the limb would have already been unsalvageably injured. So that does happen with frostbite. Both are conditions which need immediate attention, hypothermia as well as frostbite, because hypothermia can eventually lead to loss of life, and frostbite can eventually lead to loss of limb.
Okay.
So we have to be proactively recognizing these conditions.
Okay. So if someone is climbing and if you're already feeling numbness in your extremities, let's say ears and nose and fingertips, if you're already feeling numbness and you still have a lot of hours to go, so you're saying that's sort of a dangerous, sort of a situation because you're already having all the gear you're wearing, but you're still cold. So it's not going to get any better till you warm that up.
So yes, so you have to warm it, But warming it doesn't mean you are using dry air or hair dryers or hot water. So you just need what we advise is that it's what we call is a wet rewarming rather than dry rewarming. So we use water slightly warmed up, slightly higher than body temperature. Say it's around 38 to 39 degrees of temperature, the water, and you dip your fingers or toes or whatever part that has frostbite into it, and usually 15 to 30 minutes, you'll see that it's getting rewarmed. You'll see that the redness is coming back. It looks normal. The pain has gone, and then you can continue with it. But if it does not happen, so after rewarming, it doesn't feel fine, you have to get medical attention because that might be a more serious injury.
Okay. And generally, in terms of climbing and when you hydrate and everything, is regular cold water, warm water better than cold water in terms of
Yes, it is.
drinking?
Yes, it is.
It is.
So it is because your body is constantly fighting with the cold weather, and whatever supplemental warm thing you can put into your body, that's always better.
So a bit of warm water will actually help maintain that core temperature while you're going up.
Absolutely. Absolutely.
Okay. Okay. Are there any foods, medicines, or any type of foods or any kind of medicines, let's say painkillers or anything that can cause dehydration, and what to avoid at high altitudes?
So the one thing that we absolutely need to avoid that can cause dehydration, that can um, hinder our ability to acclimatize, is alcohol. So alcohol has to be avoided. Um, because what it does is that it changes the acid base balance of the blood, and so that your blood will not be able to dissolve enough oxygen, it will not be able to carry enough oxygen, and that's the first thing. And apart from that, we usually advise people to avoid medications which can cause sleepiness or which can cause problems with breathing, like some strong opioid painkillers or some sleep medications that people are not used to. So it can hinder with these things, and so that those are the drugs that we ask them to avoid. So as far as again, I'm going back to the first point that alcohol is the thing that you have to absolutely avoid.
Okay, the people who have generally have headaches and lack of sleep at high altitude, how do you deal with that? And if someone is having that, has had it, let's say once or twice, are they always going to have it, whenever they are at high altitudes?
So it's a very common symptom. It's a recurring symptom, and it is easily managed. So for headache, you can just take a painkiller. You take a paracetamol, take an aspirin. For nausea, you can take whatever antiemetic medicines you have, and you stay at the same altitude for a couple of days. You should be feeling fine after that. And even if if the symptoms recur during your next climb, you repeat the same thing. Take the same medicines, stay hydrated, stay in the same altitude for a couple of days, and then you can carry on. We don't usually advise people to descend once they develop these minor symptoms because it can be easily managed. So just carry some painkillers, carry some medications for nausea, stay hydrated, and you should be fine.
Any terms of any in terms of eating, are there any special foods that help you sleep better?
I'm not sure about sleeping better, but it's usually advised to take garlic soup or a lot of garlic because it is said to help in acclimatization. There is no very concrete scientific consensus on that, but it's usually reported sporadically that it has helped people, and that's what we advise as well. So take some garlic soup when you are climbing up. It should enhance the body's ability to acclimatize.
Okay. Okay, in terms of myth and a fact, like I've heard a lot of people talk about camphor, that smelling camphor or something like that will help acclimatize you better or deal with AMS or something. Is that a myth or does that
So,
really
so
work?
there are a lot of these kind of things that float around, and some things might be useful, some things might not be useful. But the thing is that there has not been any concrete scientific study so that we can advise for it or against it. So it's again those gray zones. Smelling camphor is usually not good for you. It can be toxic in high doses to the lungs. So that is something we would actually ask people not to do. Apart from that, if there are some other food or other small things that it is said to help, so and there is no harm in it, so you can do that.
Okay. Okay, in terms of coming to the cold, feeling cold and the hypothermia part, a lot of people while they're doing the activity, they're feeling very fine. You know, they may be warmed up, but as soon as they reach their camp and the activity ceases, and then it's generally evening time, and you know they're feeling cold. They generally like to, you know, they open the sleeping bag and then they enter with their jackets, with a heavy down jacket. And that generally does that. Do you recommend that? And what is the idea of the entire sleeping bag? You know, should one go heavy inside it or light?
So the problem with putting on a lot of clothes and going into your sleeping bag with jackets on is that it might cause a lot of sweating, and so you'll be losing fluids. So if you are able to drink properly, if you are able to replenish those fluids, get up in the morning, have a liter of two of dehydration solution, you should be fine. But if you are not able to do that, it's ideal that you don't put on as many layers, because a couple of layers should be fine.
Okay, okay, all right. I'll just look at the questions if there are any. Uh, Someone was asking, is there any daily exercise or workout to avoid AMS?
So to avoid AMS, what we say is that whenever you get to a higher altitude that you were than before, don't immediately do any form of exercise. No exertional activity. You get to a higher altitude, rest for some time so that your body acclimatizes, and then you can carry on with the exercise. But there is no specific thing that you do this and don't do that form of exercise. Everything goes once you have acclimatized.
Okay. Another point, you've already covered that a bit in in the Gamo back section, but someone is asking what happens when you go down to the lower altitude and it gets better. So what is happening within the body? So a bit of a science about it.
So the science behind it is that whenever you are going up, your body is catching up with everything. So it's dissolving more oxygen into your blood. Your respiratory rate is getting higher. You are taking in more oxygen, and you are taking oxygen faster, so that the body can maintain its equilibrium. When you go down, the body will again it will believe, when you go down fast, the body will believe you are in a higher altitude still, and it will continue to do the same thing. It will continue to increase your respiratory rate. It will continue to dissolve more oxygen in, and when that happens, by the time you have settled down, you are in a lower altitude for a couple of hours, you will be feeling fine, because again your body will be having everything it needs in time.
Hmm. Okay.
So that's the principle behind it, basically.
So this process of acclimatizing, in terms of altitude gain, is there a pace that you recommend? Is there like in a day gain this much of altitude, and then how do you pace that?
So the recommendation is that do not climb more than 500 meters altitude in a single day. So your sleeping altitude should not be 500 meters more than it was the day before. Again, when we talk about altitude, we talk about sleeping altitude. So you might have climbed 1,000 meters up, but again come 500 meters down, and your sleeping altitude should be 500 meters. And for every 1,000 meter that you climb, you have to spend an additional day. So let's say you are going from 3,000. Next day you have gone to 3,500. The next day you are at 4,000 meters. And when you reach at the 4,000 meter altitude, spend 2 days there. So 2 nights over there. And that should be good enough for acclimatization. And it goes throughout the climb.
Okay. Yeah. So I think there are two important processes. So one is the activity. You can go up to a level, so you can gain 1,000 meters a day, but sleeping would be, you can say, a 500 below
500.
that. So
500.
basically only
Yes.
500 off than your previous
Yes.
sleeping level. Okay.
Yes.
Uh, Anything from your experience you would like to add to the audience, to the active audience who are keen to go high altitude treks and climbs from your experience?
So most of the patients that I see, the thing with them is that they develop symptoms early, and most of them recognize the symptoms early. But there is, because they have trained so hard for it, they have trained so long for it, they have spent last 6 months of their lives just training to climb that mountain. So what happens is that they try to bury it. They try to bury the symptoms. They say it's just a matter of a couple of days, let me get to the peak, and then I'll take care of my health after that. And that's what causes most of the problem. So if you are having symptoms, so it is my plea that if you are having symptoms, you report it, you manage it accordingly, and if not this time, there is always next time. But there is, you just have a single life. So make sure that you are taking care of your health first before you are going for any landmarks.
Yes, I think that's a very important point. Someone was asking, are, things like heat pads, these, artificially induced sort of heat substances, are these good for climbs, for resting? When should one use it?
So heat bags, they are usually safe as long as you are using it properly. Most of the heat bags do not heat up too much and they do not cause any skin damage. So you can use it. It can be especially useful when you are having where you are rapidly climbing at you are at the peak. So you are closer to the peak. That's when you rapidly climb up. So the temperature goes cold more rapidly. So you can use it. You can put it in your gloves. You can put it in your boots or even on your chest. It can be helpful. So we do not advise against heat pads. So you can use it comfortably.
Okay, okay, all right. Uh, Yeah, any sort of medical recommendations for people who generally, I've seen some people that are prone to these frostbite kind of situations. Like for example, I get my extremes cold very early. Like my feet, my toes get numb quicker, cold quicker than other parts of the body. Some people are very comfortable with that. So people who get to that zone quickly, is there any recommended sort of exercise or points to sort of take care of? Uh,
So what happens with people who get numb or who get symptoms of frost nip more quicker is that the blood vessels that carry blood to the tips of their fingers and toes and nose and ears, they are slightly narrower. So that means they get constricted more rapidly when it exposed to cold. So the warm blood from the core cannot get to the tip of the fingers and toes as easily. Unfortunately, there is not a lot we can do when you get these symptoms. So you have to rewarm it. Make sure that you have facility available for rewarming. So even if you are carrying on with the climb, you are getting to cooler temperatures. Make sure that there is a possibility that you can rewarm. Ideally, warm water. So as long as you have that, and as long as you recognize when you have developed frostbite actually, and take care of it, you should be fine.
Okay. An oxygen canister, someone's asking, is there any use of oxygen canister, the smaller ones, uh, that you can carry in the backpack?
Yes, yes, the people frequently use oxygen canisters. Um, so again, I'll go back to the thing I talked about oxygen once again. So you can use oxygen canisters when you are having difficulty, but you have to make sure that you do not discontinue your oxygen canister once you get to a higher altitude. Say you are at 5,500, you have started using oxygen, you are climbing a 6,500 peak, get to the 6,500 peak and continue taking oxygen till you get back to the level that you started taking oxygen, that is 5,500. Because if you discontinue anywhere in the middle, you might be more prone to getting symptoms of haze or hip. So make sure
Okay.
you have enough oxygen and you can definitely use it.
Okay. And I think just the last question I'm taking, can someone travel from sea level to mountains for a trek like Friendship Peak? How many days acclimatization is required in between? So Friendship Peak is something like 5,200 meters. So I think as Dr. Adhikari has spoken about the general rule that I think you can get about 800 to 1,000 meters a day based on how you're feeling, but always sleep sort of down at the middle. So I think yeah, in about 6 to 7 days, I think you can comfortably acclimatize for something like
Yes,
that.
definitely.
So
Definitely.
I think that's about it. I think we have covered a lot. There's I think yeah, if there are more questions, I think we'll be happy to do another session sometime to take up
Definitely.
extra questions from people. That'll be so. Thank you, Doctor. Thank you for joining us and
Thank you for
sharing
having me.
such great insights to a lot of people. Because as I said, it's a very gray area for all of us. Even though we can say we have been there, we have dealt with it, but when it happens you don't know what has suddenly happened. So it's good to
That's
know, good to have that knowledge so that you can better prepare yourselves. And I think because that's the key, that's the first line of defense, I can say, to
good.
have yourself better prepared.
So, if I can conclude with something, is that just remember two key principles. The first thing is that while you are going up, acclimatize. Make sure you acclimatize. And when you are up, if you develop symptoms, descend. So, just remember acclimatize and descend.
Perfect. Thank you.
Thank you.
Thank you, doctor. Thank you. All right. Bye.